doing right this second. It takes this, gets this particular one. Okay, so that gets the, because I've had that. That's the one I've had every one of them. And this is the one I know I had to get rid of that.
And your back number was amazing.
Great.
Trust me, I spent like $100 per massage in Chinatown, in downtown, everywhere. Your back number is amazing.
Great, wonderful.
Nothing, no one gives the pleasure than us doing it ourselves.
See, you like me. I like that too. So I feel the same way. That's why I always try to fix everything myself. That's why I know all the stuff how to do it.
Because how much ever they do, we are still not satisfied.
Well, maybe I would like someone to treat me, but the thing is I'm so happy with doing it myself, you know?
Yeah, when I can do it myself, I feel like really
happy. I'm so happy that I can do it myself. But then, if I need help, okay, I'll get it. You know, it's still great to have to be able to do it myself. I like it. So you're becoming a we gotta fix my shirt again. So you're a self-care advocate now.
I'm trying. Even the breath thing.
Oh, you're
focusing.
Nice.
Whenever I recall that I'm supposed to breathe this way, I'm doing it.
Wonderful. Okay,
even though this is too low, but this feels good. The higher.
Yeah. Well, the thing is this is better. This is much better for you. So because it's encouraging.
We used to have the sit-in stand chairs.
Yeah.
Not exactly stand, but they come up to this tall.
Yeah.
Where I was working, I mean, you get two plugs like that. One is to set the height. The second one is for the rear one.
Okay. But the one I have is like also.
But having a rear adjuster is the worst thing you can do to your back, because once you start getting comfortable, you start going backwards like this.
That's right.
Which is bad.
Right.
That's what we used to do. I know why I got the pain from work, because I used to sit like this.
Like this, yeah. So
I used to sink in the chair.
Yeah. So if we sit higher up like this, you know, but I have this really high chair one that goes. I get to be here, but if I get tired of, you know, I go a little higher part, but it pushes you all the way up like this. And when I've been tested for my bone density, every bone is dense. Every bone, all my bones, every bone is dense.
Do you know the actual position I sleep in? I never showed you that.
Oh.
My actual position is I put the pillow in such a way.
That's what she wanted to see. Oh, but she was testing you on the stomach.
She asked me how I will sleep if I'm sleeping on stomach.
Yeah.
How I'll sleep if I'm sleeping on my back.
Yeah. I try different ideas.
I need another thing.
Okay.
A small.
That one's kind of small. Soft. Oh, like that. That's nice.
It will be comforting for me here.
Yeah.
And it's not coming up enough, but it generally comes like this.
Oh, it's not too bad. You know, you can.
And a pillow in between legs.
The legs things. Okay.
Definitely a pillow.
How much under the legs?
I
Not too much. Okay, give him that one. Oh, he's got it. Yeah. Okay. So
Like
that much, or higher? Okay, that's good. That's good.
depends, because they keep moving. I keep moving through the bed.
Yeah.
I start off with this position, halfway through I become like this. Then I become like this for a little. It's like my body automatically moves.
Well, what I like about some of it is that you put this part here.
Yeah.
So I like that. So that's nice.
I put this here because if I don't, I will be like this.
That would be
Which
bad.
leaves me with a very bad headache.
That would
Neck pain.
Really give you terrible neck pain. Yeah. Well,
And I don't want to put this too high, because if I do this
no,
high,
you're way too
again it will be the pain here.
No, that's causes terrible pain.
I want it to be straight from here till here.
Yeah, I like it. I like what you're doing.
And the position which I do in the morning used to be like this. I'll show you. That's from yoga. I did not teach it myself. I'll see if I get it right. I mean, I can't do it perfectly like they do it. My grandfather asked me to try. I do this.
Oh, it's a nice stretch for the front and the contraction for the
It
back.
should be like this.
Yeah, that's good. Yeah.
So it should come up like this.
Yeah,
It's called
good.
the bow push.
I like that. Yeah. bow is good. So the correction I'd like you to do also was stay down. Okay, so it would be, remember I showed you? So it'd be like, also like, put the arm next to your ear. This part of your arm next to your ear. Straight, like you're Superman!
Yeah.
Okay, so you're gonna lift your head and this leg, and then let's do opposite. So your head, this arm, these lift it down. So it's like it, see, this one. But then you're supposed to not roll like that, see? You're supposed to go straight up. Yep. So try this
On
again.
my abdomen.
Head in this one. Yep, good. And then head in this one. Yeah.
So
This is
for low back.
yeah. It's for to help you to extend. So just like you were doing. It's also what you did was doing it too. The
Yeah.
bow was good too.
The bow was for upper back. That is my grandfather. He is a yoga thing.
That's good
Totally
for
into
upper back.
yoga.
He was good at yoga.
Yeah, he does, like, he knows all the asanas. He can do everything. He was a heart patient. He's 68 something. He had the balloon blasting thing 2 times.
Oh.
After that he took to yoga.
Oh.
So he does exercises like 3-4
Nice.
hours a day. He became a vegan completely.
Wow, he did
After
that.
the second heart blasting thing, everyone kind of gave up on him.
Wow.
Like he might get a heart attack anytime. So he became a vegan, total vegan, and he practices yoga like 3 to 4 hours a day. He's healthy now. He never got a heart attack after.
That's great, huh? He did
And
perfect.
this is how he wants me to sit every
Oh,
morning.
he likes you to sit like that?
For at least half an hour, he wants me to just sit like this.
Oh, good. I saw how you corrected yourself.
Only sit like this,
Yeah.
arms here,
Yeah.
and do the breathing thing.
I see. Yeah. Yeah. I see. So he likes you to use all the whole chest. He wants you to use this part too.
Yep.
Yeah. The whole
It's
thing.
like
he's trying to use all the muscles.
it's like power breathing. First you do it
Uh-huh.
slowly, really slowly.
Yes, I see.
Then you do it medium speed.
Uh-huh.
Then you do it really fast.
Yeah. Yeah.
It's your breathing
That's
exercise.
Nice.
And just sitting this way and doing that exercise will start your day in a very free thing.
What kind of yoga is that? Does the breathing?
It's called pranayama.
Pranayama. Pranayama.
You can Google it. Pranayama.
Yeah.
The breathing exercise. I was taught this in the Art of Living classes when I was back in school. Controlling breath, one thing. Mind mapping, second thing. Mind mapping is not related to physical body anyway. It's related to remembering things.
Yes.
You see something, you only notice whatever strikes through most about it. Say for example, and you relate everything about that person to whatever strikes you the most common about it. Say for example, I don't remember your name is Sharon. I don't know that you're a doctor upstairs. But the moment you say cleanse, everything comes to me. I put a mind mapping point kind of thing there. So initially when I see you, I might not recall immediately who you are. But once you touch close to the mind mapping point, like once you say cleanse, that's my trigger. Like your trigger points in.
Yes.
That's why people downstairs, whenever after they complete their order, I come up with their name. They'll be like, oh, you remember me, even if they came only once. If they had something strange in their order, like no cheese or extra cheddar or something like
So
that.
they're extra cheddar.
I will be like completely a stranger till they complete their order. Once they complete their order, Troy, right? Sharon, right? Greg, right? They're like, oh, you remember me. It's been weeks since I came, and yeah, it's your order.
That's good. That's good. That's a good way.
Oh, I try many things. It's only because of one stupid habit my back went bad. It's the habit at work, and we used to do night shifts. That completely changed my sleep cycle.
Okay. Oh, see how we could have done
And
that.
it's the chair. I used to put it totally back, bend like this, work like this,
Oh,
with
like
stress
that.
down.
Yeah. Oh, like that.
Complete comfort zone. It will be comfortable for a while. After a while, once it starts aching, I change the position to complete like.
Oh, someone is. Okay. Could you get it? You can take his head. Okay. Well. Okay. So, let's could you give me the could you videotape us for a second?
He's here.
Oh, here's
Okay. Why don't you unplug it? Oh, sorry. So, Justin, I was wondering if you go ahead and stand up for a second, Tony. So, tell us a little bit about you said. Tell us about the back knobber.
Oh, the back knob, it's amazing. I told you during break how much I loved it. I mean, I did get $100, $120 massages somewhere in downtown, sometime in Chinatown, but the back knob did the job, man.
Yeah.
5 minutes. I mean, that worked perfectly for me because I need not guide, I need not tell the person that they're pressing in the wrong place or something. I can just do it myself. I know where it's aching, I know where to put the back knob.
Yeah.
And it's pretty comfortable too. You just need to do this.
See, it's great, huh?
There you go.
Yeah. So he had he was saying that the pain.
Which one do you use?
Yeah.
This one.
So what you were saying is
It's like as easy as this.
So just treating yourself. Show them how you're doing it. So he's pressing. So so this was the area that you had the most pain.
Yep.
And now.
It's around the bone there.
Yeah.
And as you said, just push it enough to release the
painful
chemicals
out of the tissue, right? And then what was your results after treating it yourself?
Oh, if I do this like once, I don't get the pain for 3 days, something
Yeah.
like that.
Yeah.
Because I used it only twice throughout the week, the one which you gave me.
Yes.
Twice when I really had that pain. And I only used it twice. I only used it for less than 5 minutes,
So
both the
you
times.
did protocol 11, I think. I gave you 11 to do.
Yeah.
Yeah. So great.
And then I rub it like this.
Then he does the rubbing, massaging. And then how about moving? Are you moving?
Yeah, and this thing you did tell me, but I never felt the necessity. Like this.
Okay. You're happy with that
couple
part.
of minutes. I'm extremely happy. You know, my roommates, they always used to curse and complain. Whenever I asked them to compress my back, they'd be like,
again.
And I will never be happy with how long ever they massage me. This thing worked miracles for me.
Isn't it great? Oh, wonderful. So thanks for that. That's
And
great, Tony.
even, as I said, the leg lifts, the sole lifts.
The first metatarsal lifts.
Yeah, the first 2-3 days I was starting to feel the difference. Initially when I started to notice change in my walking style. I was walking differently. I used to have very painful legs after work when I stand for 7 to 8 hours. The first 2-3 days it was the same. Then I was on the edge of, okay, let's still try. It's only wearing the same shoe every day. It's not changing anything. The 4th day I did not have any leg pains. That was the first thing I noticed. Then I was like, this is really working. I told my employer and everyone, people, whatever you say, this is really working. It's been 2 months since I've been standing for 8 to 9 hours a day. That was the only day when I left work without pain in my legs. Then the 5th day, my back pain started going away. The 6th day, I was completely myself.
Isn't that wonderful? I can't believe it. Okay, so
maybe because I'm standing for 8 to 9 hours on them throughout the day. Maybe because you might have suggested the same thing to other people too, but
Yes.
they are not doing it as frequently as me.
But you did say that it hurt a little bit the first day. How did you say it? The shoe did it hurt a little bit? The shoe inserts?
Yeah, it did hurt a little bit. The shoe inserts. My foot were sore the first day because they are standing in a totally different position from which they were used for 25 years now.
Yeah.
Second day they got a little used to it. Third day was okay. Fourth day they had nothing on them.
See,
Yeah.
so we did it.
So it was
So
24 hours of standing on the soles, and my body got used to it.
So what we did for Tony is we corrected the underlying perpetuating factors. We looked at where he had his pain. We trained him to treat those muscles that caused the pain in the area that he had the pain. And the combination of doing those two things and his innate sense of what works and doesn't work, he was getting that already. He already knew that, but all these tools helped him. And now he's pain free pretty much, almost pain free. Is that
Pretty
great?
much.
Yeah, it's wonderful. In 1 week.
No, it's a pain which was accompanying me from 3 years now. It came to US with me from India. It hurts me. It used to hurt me like crazy if I don't sleep in 20 hours. If I don't sleep 20 hours, my back gives up. It's like total pain. If I sit for more than an hour, my back gives up. If I stand for more than an hour, my back gives up. It starts aching like crazy, man.
And now.
And I used to I never used to sit comfortably. I used to sit like this for a while, move like this, move like this. I used to do stretches in class, at work, everywhere. People used to look at me like this. Why is this guy even stretching in the class?
He's trying to get rid of his pain. Okay, well that's super great. So, what great results, huh? That's wonderful.
Yeah.
So this is what I found with everybody that I worked with, pretty much. That people find that as we're correcting the underlying perpetuating factors, that they start to really get better, and we start to correct the muscles that are causing their pain. So,
and nobody else is looking at this but
that's
you
right.
guys.
Well, okay, so just keep in mind that the people that are coming to me often are people who saw me downstairs at the lunch counter, or someone who saw me. But a lot of times people are coming after they've been through numerous pain programs. They spent $50,000 on a program that tells them that their pain is all in their head, or they've been through numerous pain clinics, and they've had all kinds of pain treatments, and they've had everything done to them, and they've had, then because of all of that, they had these operations, and then they come in and I correct these underlying perpetuating factors, and all their pain starts to go away. So you can see that this is going to be a real important thing in everyone's life, to make sure that you're not you don't have these underlying perpetuating factors. And how about everybody in India? Can we tell them?
Yeah, we can.
How could we do it? We're going to have to tell everybody in India. So we'll have to broadcast into India.
Oh, it's pretty simple. If there is anyone from India watching, guys, I wanted to pay her to get a treatment because I tried everything else. Myotherapy seemed something new. I just wanted to give this a try too, because I did try the acupuncture thing. I did try the other thing where they only give me foot.
Reflexology.
Yeah, reflexology. They said
And
only
massage.
working on my foot will fix everything. Then massage. Then I had tablets for back pain. They gave me a syrup which was high on alcohol content too. I used to get high every time I had that syrup. Then after a little while I told the doctor, it's only because I'm getting high, I'm not feeling the pain, but the pain is still there. You couldn't get the pain. I just wanted to give her a try too, only a try.
So to everyone in India, you have to watch our show and correct your underlying perpetuating factors, and learn and go to protocol 11 and 12 and all the others, and fix all your pain problems and all your myofascial dysfunction. So you got to pass all the range of motion tests and get yourself even and see. Now we have a couple more to correct today. We're going to correct a couple more. How about super sensitive spinal segments, Justin?
I'm trying to remember what those are.
Okay, so we're just take a look here. So we're looking for super sensitive spinal segments. So we're so just let your head stay straight there. So we're looking. Oh, the skin lifts up here, so that there's no super sensitive spinal segment here. But it starts to get tighter right about here. So we found that right here about C5, he's very a little bit tight, but he was even tighter before. We treated it and trained him to treat it. So here we're looking. So between here and here, it's kind of tight. Oh, sorry.
So this is using your skin rolling technique.
So here it's loose. So here it's nice and loose. Here it's nice and loose. Here it's nice and loose. But here it's too tight. So C5 to about C3 is too tight. But so that's something he could keep working on, And and also maybe when he's got his shoes on, it might be better too. And also let's look in the lower back. So here, but right here, like we found last time, right here.
Yeah.
This is too super sensitive here, and so right here about L1, he's too tight over on this side, and it's pretty good on this side. So what we would do is treat right to the side, right near where it's too tight. So where you feel it's too tight, you go right there, and we're going to treat the little rotatories and multifidus there, and treat the little rotatories and multifidus here, and we keep treating it and keep changing the posture till we can pull up on the tissue. So if we change the posture, also so that they have good posture, plus you get the tension out of the rotatories and the multifidus,
Sharon,
and other muscles. Yeah.
Can you show us exactly where you're rolling? Is it over the spine, right next to the spine?
Well, it's okay. So you remember? Let's look at this here for a second. So what I'm doing is, what you want to do is, here's the spine, can you see? So you come here, I'm a few fingers away from the spine, and I'm coming down, but I could do it also over the spine, is okay too. So it's all right, is true, but this is what Dr. Fisher recommended. He recommended coming down like this, along the spine, like that. Now, what you do is you lift up and see if you can get the skin to lift up all along, and where it doesn't lift up, that's where the roots of the nerve is being compressed by it can be compressed by some of the myofascial. So it could be the fascia, it could be the muscles, it could be the ligaments and tendons right there in that area. So in his case, he was tight like right here, through here, and over right there. So what we do is we treat right along the spine here and here, and see if we couldn't get it to lift up. And once we get it to lift up, we know we corrected that. So during any one treatment, let's see if we can get it to be at least 1/3 better than we started, or maybe to completely gone. You know, so we're looking for it to be able to lift up completely, or at least be about 1/3 better. Because then you figure at least 3 treatments or so, and if they keep treating it at home, that maybe in 3 weeks or so that you'd correct that supersensitive spinal segment. So what happens is when it's tight like that, the nerve roots gets compressed all the way down to the fingers, or all the way around the chest, and the little accessory nerves come out and go all the way around the nerve, all the way around the vertebrae here. So they come out, so then that can heighten tone all the way around the vertebra. So anywhere around there you can feel and you can see if it's heightened tone. Another thing we could look for, if we could use our hammer, maybe Stephanie could find it for me. Do you think we know where my percussion hammer is? Yeah, she does know. Oh, good. So another way we could do is we could also see what's sensitive on the so we could go ahead and. But you know, I tend to like the skin rolling. We're massage therapists.
Yeah,
you know?
skin rolling's better. I mean,
you know.
why put a tool between you and the diagnosis? I mean,
totally. Okay.
You should be on the tissue with your hands.
Forget it then. We're not going to use this one.
Just so they know.
Anyway, so what you might do is you go along and you get right and you look for the more sensitive one. So you could tell tell me if that's sensitive. Right there.
Not so much.
So this would be a way of doing it, but I prefer the way that I was showing, which is and there's other ways too. There's other ways. So we could have a pressure algometer, and we could press in and look for the more painful spots. Okay, so that's another way. But then you have to treat it and then put the pressure algometer on again and see if it's less painful. Or we treat it and then we do the skin rolling again and see if it rolls better. So those are several good ways. Or you could use a skin conduction meter, and we could go along, and wherever it's heightened tone, so it would go like this. You go, then where it was heightened tone, where it's harder and where it doesn't come up, it'll go. Then it comes down. Then it comes down to here, and it'll go. So it,
You make a good machine.
So Dr. Fisher used to call that a skin conductance meter. Stephanie, could you find that piece of paper that has that? Well, it's probably right here. Yeah, it's right here. Yeah. So here, here it is. So here's a few different ways. So this is the way we did today that works really good is the skin rolling. And where the skin doesn't lift up, that's where you have the heightened tone and the supersensitive spinal segment. You could use a paper clip and go along the spine and see what part's more sensitive. You could use a reflex hammer and look which is more sensitive. You could use this, what Dr. Fisher used to call a skin conductance meter, and some people call it, other people have other names for it. But that's about $148, and then
geek.
And this is a pressure algometer, and that's $255. But look at how much this costs.
Skin rolling.
It doesn't cost as much.
Doesn't cost anything, and it feels good, and
Yeah.
it's more accurate.
That's it. It's really good. And the Dr. Fisher, who was the developer of this, he felt that the skin rolling. He said, "You must do the skin rolling." He told me I had to always do it. So I always do it. Right, Justin? Don't I always do it?
She always does this.
I always do it. I remember what he said.
Yeah, she does. She's afraid Dr. Simons is going to come back.
Dr. Simons or Dr. Fisher or Dr. Tervel.
They're going to come back out of their graves if she doesn't do the skin rolling. They're going to haunt her.
I better do it. Okay, so one of the things that we talked was the lack of using the muscles in the full range, but also we said something that could cause asymmetry is muscle dysfunction. So the one reason that people could be all dysfunctional and asymmetrical is because maybe they're QL. So take a picture right here. We'll do it on him.
Just say it. So there are a group of muscles that are just known for creating asymmetry in the body.
That's it.
Right? Where are they, Sharon?
So right here, the QL.
The QL.
Could go like this.
It likes to crank you to one side.
And then you make the shoulders like that. So it puts you like that. So the QL could do it.
It yanks the hip up on one side and the ribs down on one side.
Yep, it does that. So the hip up and the ribs down. Yep. So then it could cause asymmetry, but also the abdominals could do it. So let's tighten the abdominals. And then the abdominals could cause asymmetry and make the head
tight
forward.
Abdominals can bring the head forward, the chest forward, the shoulders forward.
Yeah, so make your...
Yeah, so you guys might want to make a note of this. So the muscles that you have to watch out for asymmetry are the QL.
Right.
The abdominals.
That's right. And also, also another, there's quite a few muscles that could cause asymmetry. But those were really...
But the big ones.
Another one that could cause it would be the levator scapula here. So you could have one levator holding up the shoulder like that. You could be asymmetrical for that reason.
Levator scap and upper trap.
You could
they can do it.
You could be tight on one group of your long, big extensor muscles could be tight on one side. And then one way to evaluate that is you could go ahead and touch your toes. And the side that's dysfunctional goes up. When you put your finger on the posterior superior iliac spine, the dysfunctional side that's short goes up with your finger.
Yep.
So go ahead and stand up again. So watch me again one more time. So he's a little tighter on the right side. So watch how he does that. Go ahead and bend and see how the right finger goes up higher.
Yep.
Okay, and come on up. So we want to treat it till that finger didn't go up, you know. So
and
that's
there's the QL. The QL loves to create asymmetry in the pelvis.
And also turn this way. How about the psoas? So if the psoas or the oblique
the psoas
abdominals.
is what I meant, yes.
I thought you meant that. That's what
I meant.
I knew you meant it.
Wow.
Okay, so the psoas. So here, a lot of times the psoas, if it's short, what if the psoas is short on one side? So then you kind of go like this. You lean forward and come this way, and also the oblique abdominals can do that to the side.
Exactly.
So then you're all uneven for that reason. So sometimes you could just be all like this because maybe you do something at work or you lean this way, you get stuck that way.
Driving a lot with your car,
right,
with
you
your
could
foot
drive
turned
your car,
out.
right,
Yep.
and you could turn this way and
Yep.
put one elbow onto something, and then people get really used to that.
Yep.
So those are a lot of ways, but there's lots and lots more. If the muscles a lot of times just get stuck. So like say for instance you have your head this way a lot, they just get stuck that way, and then you can't get them out of that position.
Yeah.
You know, so they're perpetuating it. So if we treat it, so if you learn to treat it and you treat it, and then you get it out of that way, and then you keep moving, they probably, because you get rid of the perpetuating factor of never moving it, then you keep it that way for the rest of your life.
So the way you do this is you do the postural analysis. You'll notice the asymmetries. You'll look for the muscles contributing to that asymmetry, and you fix it.
That's right.
That's it.
That's
how you do
fix
this. You fix it.
You just go ahead and you fix it.
Yep.
And then you get them symmetrical.
Yep. And that will prevent lots of other pain that is just resulting from the asymmetry that those muscles are causing.
Right. So I thought we would go a little bit more into taking a look at how to do the small hemipelvis evaluation and some of the other evaluations in a little more detail.
Yes, let's please.
Give that a try?
Yeah, please.
Okay, so let's take a look at the small hemipelvis evaluation. Yeah, we need the piano bench. So let's go ahead and let's take a look at it again. And try to talk about it in a little bit more detail. Stephanie, do you think you want to be evaluated for a minute?
Sure.
Okay, so this is I found this piano bench at a resale. So then I keep my ischial lifts in here. So I got a few of those. Okay, so come up with your Stephanie. So what you're looking for is you'd like to look at their a few different things, but you might ask them to begin with. You say to them often, you say, you're asking a few questions. So the people that have small hemipelvis almost always answer these questions this way. So we'll ask the questions and see what Stephanie says. Okay, so Stephanie.
So here's a set of questions that people who have a small hemipelvis will oftentimes respond yes to.
Okay, so Stephanie, do you sit on your foot?
No.
So show us what sitting on your foot would look like. She doesn't do it, but just give it a try.
A person with a small hemipelvis.
They tend to say yes. They would say, "Oh, I always sit on my foot."
They tend to like to sit on their foot.
Yeah,
it's more comfortable for them.
That's right. It's more comfortable for them. Okay, put your foot. How comfortable was that for you, Stephanie?
Horrible.
Stephanie didn't like it. Okay, so.
I sit on my foot.
Oh yes. Oh, look at what he said. Tony, what did you say?
I mean, I sit like
Okay, so.
all the time.
Okay, so we didn't ask him that, but this would be someone. So remember, we found that he had a small hemipelvis.
We found that he had a 12 millimeter on the left side.
And then we found that he had a 7.
And you can see that he's got his right heel underneath his left side.
Yeah. So what he's doing is he's correcting it. So his heel is correcting the small hemipelvis.
Yeah.
Okay. But the heel might not be the right size. And the heel
Might not be the right size.
Yeah, so I'm just saying, and also that makes the leg all bent too much.
Yeah.
So it's maybe a good correction for occasionally.
See how comfortable he is in that position.
But it'd be better to correct it with the small. So if you put the ischial lift under, and you don't want to do this, you have the correction. You have the right correction.
I know I did this when I'm wearing shoe. The ones with the lifts.
Then you don't want to do it. Yeah. So.
Or I do.
So.
This is like even more comfortable. Left leg.
Okay. So I'm just saying, if we correct the pelvis correctly, you won't want to do that. So I'm saying if you put the 7 millimeters in, usually you don't feel like doing it. So we could try it once you put the 7 millimeters. So anyway, so usually another question we ask is, do you like to cross one leg over the other? So go ahead and cross one leg over the other.
Put this underneath your left ischium, underneath your left sit bone.
Okay, and then cross the other leg. Okay,
That's a little soft, Sharon. Does that feel like much, or do you need a little more?
Which one did you put in?
A 7.
Oh yeah, so a little more
It's
for
a little
the soft.
softer,
Yeah.
Sharon.
Okay, so we're correcting you again.
Try this one.
Okay, so and then unbend the legs a little bit. Okay, so we're looking to see if.
Does that feel like it balances you up?
So what you want to feel is like you don't want to put the foot under. And for her, we were crossing one leg over the other. So another question would be, do you like to, Justin? Do you like to cross one leg over the other?
Yeah.
So
Do you like to cross one leg over the other, like this?
Put your leg straight now. So this would let's see Stephanie now. So right now you see Stephanie is a little higher on the left and a little lower on the right. Okay. So
It's really not much, though.
No, yes, correct, not much. Go ahead and cross your right leg over your left. Okay, so now that evened it out. You see.
So she might find that position comfortable.
So a lot of times that's why people cross their legs. Okay, but then after a while, what happens? They get uncomfortable because that gets tired, so they always uncross it. Now they put the other one on. Go ahead and put that. Now, that often makes this side really high, you see? But then they get uncomfortable, and then they stop crossing it, and then they go the other way.
Yep.
Do it again, Stephanie. So then they go this way.
So these are all symptoms of having a small hemipelvis.
That's correct. That's all symptoms. So then the way to correct it is you put a little lift under the short side. So let's see. Let's try with the small one first. So let's go ahead and put a little thinner one here. Let's put a thin one under your sit bone there. Oh, that corrects it. Okay, so now how does it feel? Do you feel like wanting to cross your legs? Yeah, so that's what usually you feel like. You feel like, oh, well, I could cross my legs, but I don't want to. That's usually how you feel. Yeah.
Mm-hmm.
So you're looking to put enough lift under that you don't want to cross your legs and you don't want to sit on your foot.
Mm-hmm.
Okay? Okay, another way you know that you might have a small hemipelvis is, do you always like to stand? So someone with a really bad hemipelvis often go ahead and stand. They have a waitress job, so turn around. So they don't sit. They hate sitting.
Hate sitting.
So they always get a standing job. So they always sell cars, or they always do something that's standing. You know, they always do a standing job, waitress.
They become trigger point therapists.
They become myofascial trigger point therapists.
Massage therapists.
They become massage therapists. Yeah.
Bodyworkers.
Because they don't want to sit uneven. You know.
Yeah.
And they got tired of doing it from grammar school, from first grade to 12th grade or
they couldn't wait for grade school to be over.
Right. They hated school. It made them like they couldn't sit down. So another thing is, were you hyperactive as a child, you know, or as an adult? and that could be a lot of times because of small hemipelvis.
Yeah.
Because you can't get comfortable sitting, and you want to stand all the time. So you want to play sports. You want to do things. You want to do things. You don't want to sit. You don't want to sit. Okay. So that's good. So it's good to have a small hemipelvis.
Keep you active.
Okay, but who had small hemipelvis? I remember I started the Fibromyalgia Clinics of America and the Paragon Clinic in 2000, and we got fibromyalgia patients coming in and myofascial patients 30 a day. How many of them had small hemipelvis?
Mickey Mouse.
A lot of them.
A lot.
Okay, and then how about the ones that came into the failed surgery clinic?
Almost all of them.
Almost all of them. Almost all had the small hemipelvis. Just about the whole group. Yeah, that's correct. Yeah. So it happens really commonly that people in chronic pain have small hemipelvis.
Well, those lumbar discs don't like to have an unequal pressure on them when you're in your seated position. When you're seated, it's about 300% the amount of weight on your disc as when you're lying on your back. So that, sitting up is the hardest part for your discs. You have a lot of pressure on them. So imagine that's the moment when you want to be as level and even as possible. So you definitely don't want to be seated uneven.
So we're going to just review one more thing here. So let's have you sit down. So now I'm going to show you how you prove that this is the proof. Okay. So what you do is you pull it out. Let me have the little one you put. And then we put it on the other side. So first of all, one more time, let's put it on this side again. First of all, it has to make them even, and they have to like it. So they have to like, oh, I like it, right? Did you like it?
Oh, makes them even, and that does feel nice.
They have to sort of like it. Then you come and you put it on the other side here, and then you notice, ooh, you have to make it uneven, and they often say, oh, they don't like it. Well, she doesn't like it. She just says she doesn't like it. So you pull it out right away. Don't let them sit on it very long. And then you put this one underneath again. And then, they feel a lot better. Okay.
Yeah.
Okay. So that's the small hemipelvis. Okay. So that's the same thing with the leg length.
And you do double the whatever they've got on a hard surface. You double it for a soft surface.
Correct. So here's a really so for you, I would give you this 1/8 inch here, and then for on a car seat, maybe I'd give you something more like maybe a 1/4 inch, like that, something like that. So maybe something little, 2 of these like this.
These flat pieces, Sharon.
You could have this 1 for when you're on a hard surface and 2 for when you're on a soft surface. Okay.
Where do you get those flat pieces?
We get these from BML Basic.
BML Basic.
Yeah, and .com.
They're called ischial wedges. Ischial lifts.
Yeah, ischial lifts, heel
lifts.
lifts.
Look up ischial lifts and heel lifts from BML Basics.
And for the first metatarsal lifts that Tony had really good results with,
mortonsfoot.com.
That's correct, yeah.
So BML Basics, look up ischial lifts and heel lifts from bmlbasics.com, ischial lifts and heel lifts. And for the first toe metatarsal lifts, you go to mortonsfoot.com.
Okay, so let's take a look at the heel lift one more time. You could help me, and Justin will be my patient again.
Okay.
Good. So let's move this out of the way. So a little bit more detail on the heel lift. So let's have you go ahead and stand there again, Justin. Okay. So again, the same thing is true. So we corrected his first metatarsal deficit. So I'm going to just go ahead use the blue wedges to do that. So just roll your foot up there a little bit. And if you could get your heel more straight back that way. Yeah, turn your toe in. Oh, good. Okay, here we go. Okay, so, oops, okay, all right, there you go. So we put a little first metatarsal. So we'll take a look. Oh, that's a little bit better. So then we're going to go ahead and then make this side higher because it's lower here, see? So we're going to make this side higher. So just put this under your heel, okay? So let me see. Oh, that makes it better. Okay, but now what's the proof? Who knows what the proof is now?
Don't do it.
Who in the audience, who could tell me what's the proof now? Does Tony know? Tony, do you know what the proof is?
Put it on the wrong side.
Okay, we're going to put it on the other side.
Wrong side, the other side.
Okay, we're going to put it on the other side here.
If it
Okay, here. Okay.
makes it worse,
Oh,
which
makes
it
it
does.
worse.
Oh, it makes it much
Take
worse.
it out. Then put it back in.
I'm suing you.
Put it on the correct side.
I'm suing you. Pain and suffering.
Okay, so that's a little bit more on how do you prove. You could check to see if you have the right lift for the person, and then they have to like it in this position, and they have to not like it when it's on the other side. Yeah,
Oh, yeah.
yeah.
The
So
opposite side.
that's how you do it.
Yep.
That's how you do it. Thank you for being the model.
And I had a surgery on this left hip, and they did a rotational, what they called a rotational malocclusion when they did the surgery, and I lost about ½ an inch on this leg.
Yes, yes.
So since then, I've had to wear a heel lift on that side.
See, so some people need to wear a heel lift, but sometimes it's only a muscle. So what if they really, they measured uneven, they meant like you did,
Right.
but really their QL is actually is short. So it's really, so we put a lift in, and really we didn't fix their QL, but later when we fix their QL, now they don't need a heel lift, you see. So sometimes it's myofascial dysfunction, and sometimes it's actually bony dysfunction. So we just need to keep reevaluating to make sure that we're giving the right correction.
But it's okay to give the lift first
Yes,
to relieve some pain.
that's right.
It sometimes makes it easier to work on the tissue.
That's right. That's right.
Because if the tissue is really inflamed, really unhappy, really held tight in a position, you put a lift under, it relaxes, then you can work on it.
Yeah. So then it's a lot less painful between treatments, and then pretty soon you might correct the muscle, and then they won't need a heel lift. let's
Then
say.
you can take it away.
Then you take it away. Yeah. So you reevaluate. Yeah. So it's good. Yeah.
Yeah.
Okay. So we I think we hit all these underlying perpetuating factors. don't
Did you
think
want to
we
go
did that?
through the Cross Weber tests again?
Well, we could do that because that's
Should
good
we
for
do that?
Yeah, we could do that. So let's test people. We're going to test for the minimum strength and the minimum flexibility. So it's the Krauss-Weber minimum fitness test. So we developed it during the time of Eisenhower, and we tested all the kids all over the country, and we decided back then. So if you were alive during the time of Eisenhower, how old would you be now?
Our age.
Okay, so they said at the time everybody our age was going to have low back pain, and of course, so they said if you can't pass, so most of the children in our country didn't pass the minimum fitness test. So they were saying that all of us children should pass that minimum fitness test. That was Bonnie Pruden. She was for doing that. So we're going to go ahead and test, and we'll take a look. So,
Right. Which of the young people?
Who would like to do it?
Young people.
Yes, let's get the young people.
Right, you young people.
Who were not alive when Eisenhower was president.
They weren't alive when Eisenhower was around. It does sound like a long time ago, doesn't it? Okay, so here's the Krauss-Weber minimum fitness test. You can see right there. If you could take a look at that. Let's see. There. Okay.
I did that last time.
Yes, you did. Yeah. So but you passed it so good. Maybe we should put somebody.
Yes, let's do Stephanie. She's
Yep.
young.
We'll see if Stephanie passes it.
Let's see if Stephanie passes it.
Oh, well, okay. Okay, we'll try it. Let's try Stephanie. Okay, come on. So we'll try you. All right, so we're going to see if you pass the crossover minimum fitness test. So let's go ahead and sit on the table with your legs out in front of you. And lots of times what I do is I start out with them doing a roll down first. This is not part of the test, but I like to do it so to make sure that they have at least some strength before I make them do a sit-up. So go ahead, just put your arms out in front, roll down slowly. Good. Okay, so she did that without any trouble. That's good. Now let's go ahead, put your hands behind your head here, and come up to a seated position. I'm going to hold your ankles. Come up to a seated position. Great. That's passing. That's great. Okay, so let's go down again. Okay, so what would not be passing would be is like you put your hands behind your head again. Now you're gonna like really try and get both. One elbow comes up first. Like try that. So this is not passing. Oh! She's trying to. She can't get up without like trying really hard.
Okay, like
you're supposed to pretend that you can't do it. Okay. Oh! That's not passing. Okay. All right. So okay, let's bend your knees. Okay, so that was for the abdominals and the psoas. Okay, so this one here is just mostly for the abdominals and not for the psoas. So we're going to go ahead, because we bend the knees, we take the psoas out. Okay, so we're going to go ahead and come up to a seated position. So that's the abdominals. Okay, that was good. She passed that. She did that really well. So so let's go ahead and lay down. Let's look at a not pass. So a not pass would be, go ahead again, and so come on up. And like, oh, I can only get up this high. Okay, now push both elbows forward. And, oh, that's not pass. But then they come like that's not a pass. So you're looking for them to do the way she did it with the elbows out to the side. So you did it really well. Pass. Okay, for this is called the spine down test. So you put one hand behind your here so you can feel the spine down. Okay. So for this, what you want to do is the tester. You get the back. Oh, you have to get it up as high. You have to get it where the back is flat on the table. Out there.
Yeah.
Okay, good. That's already a fail. Okay, so then they're supposed to hold it there for a count of 10. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. 6. Okay, it's coming, lifting.
Yeah.
Okay, it's a fail. Yeah. Okay, relax. Let's take it down. So, and then if the back starts to come up more while she's doing it, that's also a fail. So psoas needs more strength. Okay, psoas, you gotta have psoas a little bit better. Okay, all right. So let's go ahead and let's do the Superwoman. Turn over on your tummy. So now we're gonna look at the upper back muscles and the lower back muscles. Okay, so this is a way of testing them. So go ahead and put your hands behind your head again. Okay. So I'm gonna take the muscles out from below. So she's gonna go ahead and lift up. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 9, and 10. Okay, pass. Okay, and rest. Okay, so she got up there pretty good. Now we're gonna test the lower ones. So for this, she's gonna lift both legs. 1, 1,000, 2, 1,000, 4, 5, 6, 9, and 10, and down. So she could do it. You did it. Okay, so the last part is this flexibility part. So let's have you sit up with your legs out in front of you again. Sit up like a seated position with your legs out in front of you, but in front of you. Okay. So this is the seated toe touch. Okay. So here for this, you sit just like you are, and then you have your toes like this. So go ahead and touch your toes. Touch. She passes. Okay. Okay, it's the seated toe touch. You did it. Okay, so if she didn't do it, then we'd have to fix the muscles that wouldn't let her touch her toes. Yes, we sure would. Okay. Sometimes it's the psoas won't let you contract, and sometimes it's these muscles in the extensors won't actually stretch. Another way to do it is we can do it standing. Should we do it standing once?
I can never touch my.
Get up there and do it.
Okay. So go ahead and go ahead and you can there. Oh, she touched. Oh my gosh. Okay, so that's really good. So you could. So if we wanted to do it even more detailed, we could do it this way. Go ahead and stand up there. and face the
Stand
camera.
on here?
Stand on there. Okay, now go ahead, and I'll spot you here. Go ahead and touch your toes, but now go past your toes. So then you measure. So it's touch plus 1 inch. See? So she's extra good.
Did you want to show the corrections for the fails?
Let's show the corrections. We can do
I
it.
will
Let's
fail.
do it.
He's gonna fail.
Okay.
Well,
Okay.
let's just pretend. Let's just pretend that they failed,
Okay.
and then let's
alright.
show the corrections
Okay,
for
let's
each
go.
of the fails.
So we're gonna do the corrections with you. Okay.
I'm gonna fail because I
Oh,
can't.
he's gonna show this one. Okay, here we're gonna show this one. Let's go ahead.
The
This
max.
one, he's failing that one. Okay, so here the standing toe touch minus 8 inches. Okay, so we have to treat all those muscles that aren't letting you touch your toes. Okay.
I never touch my
Okay.
toes.
All right, so go ahead and stand. Okay, now we're going to do the correction for the abdominals. Okay.
These are all found online, but let's do the corrections.
Okay, so sit down. Okay, so put your legs out in front of you.
So what if you failed test 1? What was test 1
Test
again?
The abdominals with the legs straight. Okay. Well, no, that was the abdominals and so is together. I'm sorry, with the legs straight. That's the first one I did.
Okay.
Okay, so for this one, you're gonna go for the first one. It's just you're gonna roll back, so vertebrae by vertebrae, slowly. Good. Then you can put your arms over your head, and then do a cheater sit up. Okay, and roll and come on up, and come up. So come on up all the way. Yeah, that's a cheater sit up, and then you go ahead
And roll
and then
segment
roll
by
down.
segment down.
Segment by segment, down, 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 down. Make it like this, and then use momentum and come on up.
Okay, so if they
Okay.
can't pass Cross-Weber test 1, this is the
The
correction.
first
You
correction.
do this 2 to 3 times a day, 12 repetitions.
Well, that would fix it right away.
Yeah. Very soon, you'd be in good shape.
That's right. Okay, so now then to make it a little harder, then we're going to put your hands behind your head, and this time we're not going to roll down. We're just going to start with just laying down. Now you're just going to come up to a seated position. Yeah. Okay, good. But you don't have to make the head go so far forward. That's okay. Take the head back a little bit. Go again. Yeah, bend. Oh, perfect. Like come up like an airplane like that. Oh, that was good. Okay. Okay, so good. So the next one is that was the psoas abdominals together.
Okay,
Bend
now
your knees.
if you fail test 2,
You failed test 2, then you do the abdominals. Okay. So this would be again start from the seated position all the way up. Put your hands behind your head, and then you're going to roll down slowly, vertebrae by vertebrae. And that's your first part, and then you're going to come up like that. Yeah. Or you could do it a little easier. You're going to do it this way. The easiest way is this way. So you have the arms out like this, and roll down vertebrae by vertebrae, and then you're going to do cheater sit up, and come on up using momentum like that.
Yep.
And then after you get a little stronger, do it this way. Okay?
Yep.
That way. So those would be your beginning corrections, and you could do quite a few repetitions.
Yeah, I'll get a 6-pack too.
And you yes, and you get the 6-pack too.
Yeah. Okay, what-
how
what-
about
what
the
if-
psoas by itself?
what if you fail the psoas by itself?
Okay, so here's the psoas by itself correction. So what you want to do is go ahead and get your body more onto the table so your head's not off there. You're pretty tall. Yeah. Yeah, yeah. Okay, so you put one hand under your back here so you can feel if your back is flat. So for this, you particularly bend your knees. You're going to bend your knees. Okay, and you're going to bring this is the correction, not the test. So you're going to bring your knees to your chest like this. Then you're going to take your legs up in a comfortable, like there. Then you're going to take them in. Then you're going to take it out about let your head rest up there. Take it and then take. Okay, so then I wouldn't take it out too far for you. So I would take it down as far as I could, when my back doesn't come off the floor. Okay, and my head stays down.
Okay, so
Okay,
ideally,
so you go up straight,
you're up straight,
then bend again.
and bend in again,
Then you come out about
then
here.
out 45,
And then
then
you come
bend
down
in,
as low as you can come
then
without your back coming off
30,
the table. Your head
bend
coming
in,
off.
and if
Okay,
he was
straight
really
up to the
good,
ceiling,
if he was really
straight up to
good,
the ceiling. Okay.
as he got better, he could go all the way to 10, show us 10,
this would be like really good.
So
So
right
you
then,
can do 10 coming with this
and then
here,
come back.
and this would be like here. This would be, and then you come here, but your back doesn't come off the floor, and
Right.
it's easy to do. Okay,
So-
he's starting to do it. Yeah, right, good.
So the idea is to keep his back flat on the
Flat.
table.
Right.
Yeah, it's 90 degrees, 45 degrees, 30 degrees, and then 10 degrees.
That's it. That's the. So that's usually the way we start. We start up here, then bend, then we give it a little break. Then come here, give it a little break. Then come down as low as you can. Give it a little break. Okay, so this is the beginner. This is the beginner way of getting started.
That's how you correct if you didn't pass number 4.
Okay, then next, if we didn't pass 5 and 6.
5 and 6.
Okay, so let's 4 and 3. Okay, maybe it's 4. What? Any rate, the upper and lower back.
Yeah.
Let's go ahead and lay on your tummy.
Oh yeah, maybe it's 4 and 5. Sorry.
I think it was 4 and 5.
Yeah. Sorry.
Okay, so for this, what you're gonna do is you're gonna do like the Superman. You're gonna have your arm and your head come up together. So you're gonna just do your left arm and your head and down.
There you go.
Right arm and the head, but don't go like this.
Yeah,
Okay.
do it
What you
straight.
want to do is straight up.
Straight
keep that arm
extension.
really close to your head. Then, So a little bit closer and lift straight up. Good.
Okay,
Then
12
you're
reps,
going-
3 times a day.
Now let that rest.
Each
Okay,
arm.
Your head, like that, and let your forehead rest on your hands.
There we
Like
go.
your forehead, not your chin, your forehead. Your forehead on your hand. Yeah. Okay. Okay. So next, you're gonna lift your right leg up.
That's my left leg.
Oh, I'm sorry.
One leg at a time, that's the point.
Okay. Okay. Sorry. Then the next leg. Go ahead.
Yep.
And then the next leg.
Yep, 12 reps.
There you go. Like that. Then after you do that,
You can
then,
certainly do this on the floor, yes.
then you do opposites. Okay. So then you do
I got it.
this. Okay.
Yep, good. This
Go
is a
ahead.
good cross crawl
Lift all those.
exercise.
So go ahead and lift these,
This is for
and then down, but try not to roll to the side. Again.
good neurological coordination
Yes,
as
there
well.
you go. Straight up. Straight up. Straight up. Okay. And then this side, make sure you don't roll. Okay, straight up.
And after doing these,
Okay,
3
great.
reps, 3 sets, 12 reps a day, he will begin to pass test number 4.
That's right. And so next we're going to have you go ahead and stand up. And then
Test
we're going to
number
look for
5,
the
sorry.
flexibility test. So
Yep,
Tony,
that's
and all of us, you all do it with me. Everyone can see if they can find a way of doing it.
And we'll close with this.
Okay, so what you want to do is you're going to increase your flexibility. So you can just go ahead like this. You're going to put your hands behind your back like this, put your chin up. And we're going to go side to side. Kind of cut here, stretch,
That way.
and stretch, and stretch. And we're skaters. We're Olympic skaters. We're not Olympic sitters. We're Olympic skaters. That's what we are. So this is the correction for the flexibility. So that's the
Fantastic.
Krauss-Weber test.
All right, so now you've learned the 6 Krauss-Weber tests and the corrections if they fail.
Right, we did. So we started out with this one, test 1, test 2, legs straight, legs bent, test 3 for the psoas, test 4 for the upper back, test 5 for the lower back, and then test 6 for the flexibility.
Overall flexibility.
Yeah.
All right, guys, now this.
Just about.
So let's just summarize. So far, you have learned the upper body perpetuating factors and the lower body perpetuating factors.
That's right.
If you do not address these, your patient will likely find no one else who ever will.
Good boy.
And this means that they will live in perpetual pain for their entire lives and need continuous treatment. But the perpetuating factors are working on them 24 hours a day, where you are only working on them 1 hour a visit. So who ultimately wins is oftentimes the perpetuating factor. So let's be sure to correct on every patient, make it part of your initial intake, or I highly recommend an ongoing intake process where you evaluate 1 or 2 perpetuating factors each visit, so that each visit consists of plenty of gushy, happy, mushy, feel-good massage time, hands-on, elbow time. They love to have that every visit, but you also use some intellectual part of your visit. Say it's an hour. Let's take 15 minutes and let's do a correction of a perpetuating factor each time, because by the time your 12 visits are up with this patient, you'll have corrected every perpetuating factor, plus you'll have worked on every muscle that needs to be worked on, and that person is going to believe that you came from another planet, trained by some a higher, superior form of medical assistance, and they're going to refer everybody in the world to come see you.
They're going to come to see you.
Yes. So that's what you want.
That's it. Well, so next week we're going to do the first metatarsal deficit in great detail.
I'm going to make you an absolute expert.
We'll make you a posture pro.
You're going to be a posture pro.
You can be a posture pro after next week.
This is so critically important to so many patients. It just changes lives. One little metatarsal lift makes all the difference in the world. So we're going to make sure you know exactly how to do it, how to prove it to your patient so your patient can see it, and everything. Okay?
Okay, so we'll sign off with our sign off song.
Okay.
Here we go.
Why don't we do increasing stretching of the low back?
Okay. So let's do the pelvic tilt.
Okay.
Who want you to remain free? We will assess and use heat, then compress and repeat.
Oh man.
When a trigger point is there,
And back.
we'll teach you how to do
All
self-care.
the way around.
This will keep you at your peak.
Other side. Other way.
So see you back again next week.
You're welcome, guys. Thank you for attending. We love you very much.
Super.